Yeah.
All right. So first we're going to say, hi, I'm Christina. I'm the PA is going to be taking care of you today. Can you verify your name and date of birth? Give it to me. Then we're going to discuss the procedure. We're going to give them a quick overview of what the procedure entails. You're not going to tell them every single step, like I'm going to be removing the needle cap, withdrawing the medication, putting it. You don't want to do that. It's just a quick, I'm going to be performing a lumbar puncture on you. Do you know what that is? Yes or no? And you give a brief overview as to that you're going to be putting a needle in their back. It's going to withdraw fluid, and you have to discuss with them the indication, why you're doing it, usually meningitis or to rule out subarachnoid hemorrhage. You're going to discuss the risks and benefits of the procedure. So what is the good things about me doing it? What could be the possible bad things, complications? And then I don't always discuss the risk of refusing, but if they say like, oh, I don't want that done, you need to explain to them what could potentially happen if they don't have it done. So that's all about gaining, consent, informed consent. So then you're going to gather your supplies. We want a lumbar puncture tray. Pretty much everything we need is in there. The only other thing we need besides that is going to be betadine that your nurse is going to have for you, and your sterile gloves. And we're going to pretend these are my sterile gloves here. So verbalize, we're going to position the patient either sitting up, leaned forward, or we're going to have the patient on the lateral side. We need to verbalize that we're putting him in the right position. Then we're going to kind of find our landmark. So you're going to go in the iliac crest, and you're going to come and feel for your spinous processes. You're going to go just below that. You're going to meet your thumbs in the middle, and that's where you're going. Most important part about an LP is finding the right space to go to. So make sure you're practicing with your classmates. So once you find that spot, okay, I know it's there, I'm going to take either the cap of a needle, the cap of my pen, and I'm going to make a mark there that's going to stay. Okay. Once I have my mark done, then I'm going to go wash my hands. So wash my hands, and then I'm going to put my gown and my mask on, and I'm going to put, I'm going to open this part of the lumbar tray, take this off, and then I'm going to go ahead and open the little sleeves up, just touching the outsides of it so that I don't ever go across my sterile field. Everything is staying outside of my sterile field. Pulling this out. And then you'll want to take it out of this plastic on the bottom. Okay, so then it's nice and sprayed out. I'm good. Then I'm going to put my sterile gloves on. Right? Yes. Okay. So these are my sterile gloves. Pretend that I put my sterile gloves on, okay? That you should be practicing, right? Alright, so now I have my sterile gloves on. I'm going to arrange my supplies in here. It's kind of an all-inclusive kit. Like I said, the only thing it doesn't come with is your betadine. So be careful. This is all sterile. You want it just to stay in the sterile area. You're going to take your tubes and you're going to set them up. So they're all numbered 1, 2, 3, 4, and I'm going to take the cap off and set them up in their little stand. Okay. All right, now that I got my tubes, I'm going to draw local anesthetic. So I'm just going to get my anesthetic ready. There's 2 cc's in the lidocaine vial that it comes with. So you'll want to grab this, and I'll put my smaller needle on. You're going to want to break this, but not really. You break this, the glass, then you'll withdraw the medicine into your thing. It gives you 2 cc's of medicine. So once you have it in here, you discard your sharp, and you can put your cap on because you're not going to use it just yet. You haven't prepped the patient yet. What's the next step? Okay. Apply the betadine solution. So now is where we need our nurse to help us with the betadine. This is on the sterile field. You're going to have the nurse pour the betadine in this slot right here. And you're going to grab one of your preps. You're going to dip it in the betadine, and then you're going to get the excess solution off. You're going to start where your mark is, and you're going to go in circles, going outward, 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 and give yourself a nice big area to work with. You're going to chunk that. The second one, same thing. Starting in the middle, again, going like that. That's one of the reasons why you don't want to use like a pen mark, because sometimes you can wipe it off with the betadine. Grab some of that, bring it out. Do the same thing, big circles, and chunk it. Okay, so now we've prepped it. Then we're going to put the drape on. So there's 2 drapes that come in your kit. One has adhesive and it's fenestrated, and the other one's just a flat drape. So you want to find where the adhesive is. I see it right here. I'm going to be careful to open it up because it's sterile. Keep it away from me and everyone else. You'll see that there's adhesive back here. You'll want to find where your mark is right in the center of your hole, and you'll remove the adhesive and you'll stick it to their back. Okay. So This is all nice and sterile now. Then if you need to, you might want to open this one up and either kind of tuck it underneath here, or you can set it to the side. I set it right here so I have more sterile field to work with. And this will be at peace, so it's not moving around as much. If someone wants to come hold it, that would be helpful. Cool. All right, so that's good right there. That's my mark. Right there's my mark. All right, so then we're gonna choose my space, which I already have a mark there, so I'm good. I'm gonna start putting the anesthetic. So I have the little needle on here because I'm gonna make a wheel first. So if that's my mark right here, I'm gonna start a little bit away from the mark, and I'm gonna go so that the bevel of my needle is just underneath it. I'm gonna aspirate, and then I'm gonna inject so that I create a little wheel where my mark is, a little wheel. Okay, and then I'm gonna remove it. Now with this one, now that I have a little wheel there, I can go and do a little bit of anesthetic kind of deep. So withdraw, push as I'm withdrawing, boom. Now I'm gonna switch my needle to the longer one. Now we want to get deeper. So I'm gonna put my long needle on here. I already have my mark. I'm gonna go just where my mark is. I'm gonna go in and I'm gonna withdraw, push the medicine as I'm pulling out, and I angle just a little bit up, withdraw, push the medicine as I'm pulling out, and then do the same thing, kind of angle downward a little bit, not too much, but get that medicine there. It works pretty fast. 30 seconds to a minute and a half, you're done. All right, now's the good stuff. We're gonna use our spinal needle. Kit will always come with a needle, and this one's a nice cutting needle. So you want to position yourself so that you're looking straight at it. I already checked my landmarks. I know my mark is here. Make sure that I'm midline, and then I'm gonna go in. I'm gonna feel a pop. If I don't know exactly where I'm going, if I don't know that I'm in or not, I'm gonna keep checking. So as I'm going in, I'm gonna check with my stylet. I'm not in. I'm gonna insert a little more. Check with my stylet, and oh, I'm in. Okay, so I'm gonna leave the stylet there. This is where you would check an opening pressure if you're gonna check an opening pressure. But for the practical purposes, we're not checking an opening pressure. Let me just turn it so I make sure I get it all. All right. Good. At this point, CSF is flowing freely. This is where you would check opening pressure. Now we're going to collect. We're collecting from 1 to 4. So I'm going to remove this. You can pull it down a little bit. I don't want it to come out so forcefully. Make sure I'm in tube 1. I'm going to remove this. I'm going to collect. And as I'm collecting that, I'm going to grab the other one. Okay, I'm going to collect, according to your book, 5 cc's. No, 3 to 4 ml. So. And then I'm gonna have my nurse. It's not going anymore, but
oh, I'm sorry.
It's okay.
I got you.
So then I'm gonna give this to my nurse. She's gonna hold it. Just set it there. And I'm gonna fill up the other 4 and do the same thing, kind of passing it along. Once I'm done, I'm gonna return the stylet to its position, and then I'm gonna hold pressure in the patient, remove the needle. And then right after I do that, I'm going to have a little piece of cotton or something I'm going to place there, and then a Band-Aid. It's going to go across. Once I put the Band-Aid on, I can remove the adhesive, set it to the side, and then use whatever else I have to clean the betadine off because it'll itch. Clean that all off, and then I'm going to have the patient lay flat. I'm going to wash my hands, discard of all my sharps, my stuff, and then I'm going to explain to the patient the post-care instructions and understanding of those instructions. Any questions? Okay, that's it.